Hi, good morning everyone. Today we're going to have an interview. One of our patients who have undergone hip replacement surgery here in Thailand. So I want to introduce you to Mr. Vivian Sanders, 69 years old from Queensland, Australia. Hi, Viv.
Hi, lovely. You're beautiful.
Thank you. How are you? How are you?
Good.
Okay. Well, my first question will be, why did you choose to have your surgery overseas instead of doing it in Australia?
Because I couldn't get it done in Australia efficiently, cost-wise, time-wise, everything.
How long you were in pain?
2 years.
How did you find global health travel and your overall impression during your first contact?
Very, 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 very good. Most impressed. Beautiful people.
How long did it take you to have an appointment here in Thailand?
Oh, a few days.
That's good. Were you nervous before coming over?
No. I wasn't.
No.
No.
What was the thinking of your family when
Family said, I don't know, going all that way, what if you have complications? No, we're very worried about you. But they had nothing to worry about.
What was your first impression in the hospital?
Oh, so professional. Leaves our hospitals for dead. State-of-the-art hospitals, beautiful people, beautiful service. Just so impressed.
Who is your doctor?
Dr. Sitthiporn, I think. That might be the correct pronunciation.
Yeah.
Beautiful man. Beautiful man.
Yeah, he is. How did you feel after walking out of the consultation room and after seeing Dr. Sitthiporn?
On top of the world. All the confidence in the world. Beautiful man.
What was your clinical diagnosis and what are the after a series of tests done, and was it any different when you had your checkup in Australia?
Yeah, it was severe osteoarthritis for the right leg. I had it in Australia, but the actual medical team weren't even interested because they weren't interested in doing the procedure because no money, mostly. What else did you want to know?
That one.
Yeah.
And when did you have your procedure done?
On the 26th of last month, which is March, isn't it? No, April.
Yeah, April.
That's right.
And can you still remember the series of tests that needs to be performed before you go for surgery?
Yeah.
Can you still enumerate them?
Can I memorise them? Gee, blood tests, X-rays, everything. I just can't remember all of them, but they're all so efficient, all done so quickly and easily, all in one day.
Alright. So what procedure did you undergo?
As far as the hip replacement, cementless total hip replacement.
Alright.
And the reason being cementless, the cement type, you can walk on it virtually the next day, but the doctor said that he prefers the cementless because you can get some after effects from the cemented ones. So he prefers that you have the cementless. It does take longer before you can walk on it, but you shouldn't have any more trouble whatsoever than that. I took his advice.
Alright. So what was the prognosis after the surgery?
What do you mean, prognosis? How was I? Actually, the first few days, hardly any pain. After the spinal, whatever it is they do, wore off, it did start to get a bit of pain, but really no worse than before I had the operation. No worse, because it was, yeah.
How did you feel when you woke up after the surgery?
Felt terrific. All the beautiful nurses looking after me.
Oh, that's
And
good.
then beautiful facilities, state-of-the-art rooms in the hospital, everything.
Are you in pain now? Are you still in pain now?
Not much, no.
Was there any difference of the pain you felt before the surgery compared to having, after the surgery?
Any difference?
Mm-hmm.
Oh, no, not really. Not really. Maybe after the surgery sometimes it might have been slightly more severe, but most of the time not much difference.
Is your pain alleviated compared before?
Now, a lot less now than what it was before.
How much did the procedure cost in total?
Well, approximately about $18,000.
So the big question is, would you recommend other Australians who are on a long waiting list or suffering in pain like you did before to travel overseas and jump the queue of elective surgery?
Well, if you want it done and you want a life, Thailand's the only way to go, as far as I'm concerned.
Because there's a lots of Australians in a similar situation who think you're probably crazy traveling to Thailand for hip replacement. So do you have anything that would you like to say to them?
Well, if you want to take a holiday, enjoy yourself with beautiful people and get the procedure done and out of the way so you can get on with your life, that's the only way to go.
Do you have any tips or suggestions for these people?
Any suggestions? Just do it as soon as possible. Don't muck around.
And lastly, how did you find the pre-operative and post-operative care and assistance provided by Global Health Travel?
100% beautiful people.
Would you recommend them?
I would definitely.
Thank you so much, Viv, for giving us an opportunity to interview you today. We are glad that we are able to help you. So hopefully we can help more Australians, more people in the similar situations. So in behalf of the Global Health Travel team, we wish you a speedy recovery.
Well, thank you very much, lovely. It was beautiful.